Is ibuprofen really as safe as we think? It's the go-to choice for pain relief and fever, but behind this common pill are serious risks that most people don't realize. Can ibuprofen actually lead to heart failure, stomach ulcers, kidney damage, or even high blood pressure? In this video, I'm diving into the truth about ibuprofen, how it works, what it does to your body, and the hidden side effects you need to know about. So let's get started with the basics with what is ibuprofen and how does it work. Ibuprofen is a type of medicine called a non-steroidal anti-inflammatory drug, or NSAID. It works by reducing hormones that cause pain and swelling in the body. When you apply ibuprofen to your skin, it works in the same way as when you take it as tablets, capsules, granules, or liquid, but it only works in the area you've applied it. So what are the other types of NSAIDs? The common ones include diclofenac, naproxen, celecoxib, aspirin, or ketoprofen, amongst others. So who may not be able to take ibuprofen? So don't take it by mouth or apply it to your skin if you have ever had an allergic reaction or symptoms like wheezing, runny nose, or skin reactions after taking aspirin, ibuprofen, or other NSAIDs such as naproxen, or if you are pregnant. To make sure ibuprofen is safe for you, tell your doctor or pharmacist if you have ever had bleeding in your stomach or a hole in your stomach caused by an NSAID. If you have had a hole in your stomach, bleeding in your stomach, or a stomach ulcer more than once. If you have a health problem that means you have an increased risk of chance of bleeding. If you have severe heart failure, severe kidney failure, or severe liver failure. If you are pregnant or trying to get pregnant. If you have high blood pressure that's not under control. If you have heart disease or mild to moderate heart failure, or have ever had a stroke. If you have kidney or liver problems. If you have asthma, hay fever, or allergies. If you have Crohn's disease or ulcerative colitis. Or if you have chickenpox, because taking ibuprofen can increase the chance of certain infections and skin reactions. Or if you're over 65, ibuprofen can make you more likely to get stomach ulcers. Your doctor will prescribe you a medicine to protect your stomach if you're already taking ibuprofen for a long-term condition. So what's the dose for the tablets or capsules? Each ibuprofen tablet or capsule contains 200, 400, or 600 milligrams of ibuprofen. Slow-release tablets and capsules contain 200, 300, or 800 milligrams of ibuprofen. The usual dose for adults is 1 or 2 200 milligram tablets or capsules 3 times a day. In some cases, your doctor may prescribe a higher dose of up to 600 milligrams to take 4 times a day if needed. This should only happen under supervision of a doctor. If you take ibuprofen 3 times a day, leave at least 6 hours between the doses. If you take it 4 times a day, leave at least 4 hours between doses. If you have pain all the time, your doctor may recommend slow-release ibuprofen tablets or capsules. You'll usually take these once a day in the evening or twice a day. Leave a gap of 10 to 12 hours between doses if you're taking it twice a day. So how do you take it? Swallow ibuprofen tablets or capsules whole with a drink of water, milk, or juice. Don't chew, break, or crush or suck them, as this could irritate your mouth or throat. For people who find it difficult to swallow tablets or capsules, ibuprofen is available as a tablet that melts in your mouth, granules that you mix with a glass of water to make a drink, and as a liquid. If you're taking the tablet that melts in your mouth, put it on your tongue, let it dissolve, and then swallow. You don't need to drink any water. If you're taking ibuprofen granules, empty the contents of the sachet into a glass full of water. to make an orange-flavoured fizzy drink. Stir and drink straight away. If you take ibuprofen with a meal or snack or with a drink of milk, it will be less likely to upset your stomach. If you take it just after food, ibuprofen may take longer to start working. So when will you feel better? You should start to feel better 20 to 30 minutes after taking it. For some types of long-term pain, you'll need to take ibuprofen regularly for up to 3 weeks for it to work properly. If you're applying ibuprofen to your skin, it should start to work within 1 to 2 days. However, if your symptoms get worse or last more than 2 weeks, check with your doctor before continuing to use it. So how long do you take it for? If you're taking ibuprofen for a short-lived pain like toothache or period pain, you may only need to take it for a day or two. If you need to take ibuprofen for longer, or if you have a long-term health problem such as rheumatoid arthritis, you need to take it for more than 6 months. Your doctor may prescribe a medicine to protect your stomach from any side effects. So what are the common side effects? Headaches, feeling dizzy, feeling sick or being sick, wind or indigestion. So what are the serious side effects? Now call a doctor straight away and stop taking ibuprofen. If you have black poo or blood in your vomit, these can be signs of bleeding in your stomach. If you have swollen ankles, blood in your pee or not peeing at all, these can be signs of a kidney problem. Or go to the hospital accident and emergency department. If you have severe chest or stomach pain, these can be signs of a hole in your stomach or gut. If you have difficult breathing or asthma symptoms that become worse. If you get a severe headache, a high temperature or stiff neck, and a dislike of bright lights, these can be signs or inflammation of the protective membranes that surround the brain and spinal cord. If you have blurred vision or you see or hear things that are not real. If you have severe skin reactions with blistering and flu-like symptoms and your face and your tongue swell, or if you get a serious allergic reaction. Now, these are not all the side effects of ibuprofen. For a full list, see the leaflet inside your medicines packet. Now, what are the cautions with other medicines? Now, ibuprofen doesn't mix well with some medicines, and if it's applied to the skin, it's less likely to affect other medicines than if you take it by mouth. For safety, do tell your doctor or pharmacist if you're taking any of these medicines before you start taking any type of ibuprofen. Medicines that help to prevent blood clots such as warfarin. Anti-inflammatory painkillers such as aspirin, diclofenac, mefenamic acid or naproxen. Medicines for high blood pressure. Steroid medicines such as betamethasone, dexamethasone, hydrocortisone or prednisolone. Antibiotics such as ciprofloxacin, levofloxacin, moxifloxacin, norfloxacin. Antidepressants such as citalopram, fluoxetine, fluvoxamine, venlafaxine, paroxetine or sertraline. Diabetes medicines such as gliclazide, glimepiride, glipizide or tolbutamide. Now, if you're taking ibuprofen with other painkillers, it's safe to take ibuprofen with paracetamol or codeine. But don't take ibuprofen with similar painkillers like aspirin or naproxen without talking to your healthcare provider. Ibuprofen, aspirin and naproxen belong to the same group of medicines called non-steroidal anti-inflammatory drugs, so if you take them together, it may increase the chance of you getting side effects like stomachache. NSAIDs are also used in medicines you can buy from pharmacies, such as cough and cold remedies. Before taking any other medicines, check the label to see if they contain aspirin, ibuprofen or other NSAIDs. So how does ibuprofen compare with paracetamol or aspirin for pain relief? Ibuprofen is good for period pain, toothache and migraines. It can also be used for back pain, sprains and strains, as well as pain from arthritis. Paracetamol is typically used for mild or moderate pain. It may be better than ibuprofen for headaches and stomachache. Aspirin works in a similar way to ibuprofen. Like ibuprofen, it's good for period pain and migraines, but if you have heavy periods, it can make them heavier. So can you develop stomach ulcers or gastric bleeds? If you still need ibuprofen after taking it for 10 days, check with your doctor before continuing, because taking ibuprofen for a long time does increase your risk of getting a stomach ulcer or bleed. The MHRA, the UK Medicines Watchdog, has highlighted the high risks with piroxicam, ketoprofen and ketorolac in the past. Of the most common NSAIDs, low-dose ibuprofen offers the lowest risk. Proton pump inhibitors such as omeprazole are usually prescribed alongside long-term use of NSAIDs to protect your stomach and reduce your risk of any stomach issues. So if you would like to know more about omeprazole, I will leave a link down below. So can ibuprofen cause heart failure? There is evidence to suggest that NSAIDs such as diclofenac and the coxibs are associated with cardiovascular risks that are higher than the NSAIDs such as ibuprofen. Even the FDA, the US Medicines Watchdog, has warned us about this. Low-dose ibuprofen and naproxen are still considered to have the most favourable cardiovascular safety profiles. Even ibuprofen at very high doses of greater than 2,400 milligrams per day has shown only a small increase in cardiovascular risk. So does it cause kidney damage and high blood pressure? Now, NSAIDs can make your body retain fluid and decrease the function of your kidneys by the nature of how they work. This may cause your blood pressure to rise even higher, putting greater stress on your heart and kidneys. The elderly patients may be especially at greater risk of this. So my key takeaway is this: always talk to your healthcare provider before taking ibuprofen so they can help determine if it's safe for you based on your unique health needs. You should always use the lowest effective dose and the shortest duration of treatment necessary to control the symptoms to minimize the risks to your heart and your stomach. Now, I hope you found this video helpful, and if you've had any experiences with ibuprofen, please share them in the comments below. Don't forget to check out my other videos and playlists for more insights on health and wellness. Thank you for watching and take care.